Blood in your cervical mucus isn't always a red flag. Cervical mucus changes throughout your cycle as your hormones fluctuate. You may notice a little bit more cervical mucus as you're approaching ovulation. It's becoming watery, stretchy, and clear. If you're noticing a little bit of blood or red tinge in your cervical mucus, it could be related to ovulation. It could also be related to implantation, which happens about 6 to 10 days after ovulation. It could also, in fact, be your period starting. So a little bit of spotting prior to your period can show up in your cervical mucus in that luteal phase. Most spotting or blood-tinged cervical mucus is harmless. However, if you're starting to see a lot of bleeding, you're having some pelvic pain and or cramping that is not associated with your period, if you're having any type of foul smell, anything like that that's going on, a fever, you definitely want to be checked by your healthcare provider just to rule out anything serious. You can use the free Premom app in order to track your cervical mucus. That way you are informed about what changes are happening with your body, especially as you're going throughout your cycle. As mentioned before, your hormones are changing throughout the cycle, and that is going to cause a little bit of difference to your cervical mucus. So I highly recommend tracking your cervical mucus along with your ovulation predictor kits, your basal body temperature, and your PDG testing strips if you're using those. You can keep track of all of this information in the Premom app. That way you have a better picture and can look right at your Premom chart and know exactly where you are in your cycle and what that cervical mucus may be related to. Again, if you're experiencing anything abnormal, even if you're in early pregnancy, I definitely want you to talk to your doctor.